Ever wondered how peptic ulcers are treated? Peptic ulcers, a common ailment, are open sores that develop on the inside lining of your stomach, upper small intestine, or esophagus. Often they're the result of an imbalance between digestive fluids in your stomach and duodenum. Symptoms may range from a burning sensation in the abdomen to nausea, bloating, and, in severe cases, vomiting blood. Although they can be quite discomforting, the good news is that they're treatable. The key to treatment lies in a proper understanding of the medication involved. Drugs used in the treatment of peptic ulcers work in various ways to heal the ulcers, reduce the chances of them returning, and minimize complications. These include proton pump inhibitors, H2-Receptor Antagonists, Mucosal defense enhancers, Antacids, and Cytoprotectants. Each has a unique role and mechanism of action. Understanding the types of drugs used in treatment can help demystify the process. The first class of drugs we will explore are proton pump inhibitors, or PPIs. These are a group of drugs whose main action is a pronounced and long-lasting reduction of stomach acid production. They are the most potent inhibitors of acid secretion available today. So how do PPIs work? Well, they do their job by blocking the enzyme in the wall of the stomach that produces acid. This enzyme is known as the gastric proton pump, and it is located in the parietal cells of the stomach wall. This enzyme is responsible for the final step in the production of gastric acid. It transports hydrogen ions, known as protons, into the stomach. The PPIs block this enzyme, thereby reducing the production of stomach acid. Now let's look at some examples of PPIs. First up, we have omeprazole. This is a PPI that is commonly used to treat conditions like gastroesophageal reflux disease, peptic ulcer disease, and Zollinger-Ellison syndrome. Next, we have esomeprazole. This is the S isomer of omeprazole, and it is used to treat the same conditions. It is thought to be more effective than omeprazole because it is better absorbed and is less subject to first-pass metabolism. Finally, we have lansoprazole. This PPI is also used to treat a variety of conditions related to excess stomach acid. It works in the same way as omeprazole and esomeprazole, but it has a different chemical structure. It's important to note that while PPIs are highly effective, they are not without side effects. These can include headache, nausea, diarrhea, abdominal pain, fatigue, and dizziness. However, these side effects are usually mild and go away on their own. In conclusion, PPIs are often the first line of defense against peptic ulcers. They reduce the production of stomach acid, thereby creating a less acidic environment in the stomach. This helps to promote healing of the ulcer and reduce symptoms such as pain and discomfort. So the next time you hear the term proton pump inhibitor, you'll know exactly what it means and how it works. Next in line are H2-receptor antagonists. Now, these are a class of drugs that play a vital role in the management of peptic ulcers. But how do they do it? Well, their primary function is to decrease the production of stomach acid. They achieve this by blocking histamine from binding to H2 receptors on the parietal cells in the stomach lining. When histamine can't bind to these receptors, the cells produce less acid. It's like throwing a wrench into the machinery of acid production. The normal process gets disrupted, and the result is a stomach environment that's less acidic. This is beneficial for those with peptic ulcers, as it allows the ulcers to heal and prevents further damage. Now let's talk about some specific H2 receptor antagonists. One of the most commonly used is ranitidine. You might know it by its brand name Zantac. Ranitidine is often used to treat and prevent ulcers in the stomach and intestines, and to manage conditions where the stomach produces too much acid. Another H2 receptor antagonist is famotidine. It's also used to treat ulcers in conditions where the stomach produces excess acid. Famotidine is known for its long-lasting effects, with a single dose able to reduce stomach acid for up to 12 hours. It's worth noting that while H2 receptor antagonists are effective in reducing stomach acid, they don't provide immediate relief from heartburn. This is because they don't neutralize existing acid, but prevent the production of new acid. Like all medications, these drugs come with potential side effects, including headaches, dizziness, and constipation or diarrhea. However, these are usually mild and go away as the body adjusts to the medication. In conclusion, H2 receptor antagonists like ranitidine and famotidine are vital players in the fight against peptic ulcers. They work by disrupting the normal process of acid production, creating an environment that allows ulcers to heal and prevents further damage. H2 receptor antagonists are another effective tool in the fight against peptic ulcers. Let's now focus on mucosal, defense enhancers, antacids, and cytoprotectants. Imagine your stomach lining as a fortress, constantly under siege by stomach acid. These three types of drugs are like the castle's defenders, each playing their role in keeping the fortress intact and functioning. First up, we have the antacids. These are the foot soldiers in the battle against stomach acid. Antacids work by neutralizing the stomach acid, thereby reducing its corrosive effect on the stomach lining. They are the quick response team, offering rapid relief from symptoms. Examples of antacids include calcium carbonate, aluminum hydroxide, and magnesium hydroxide. You might recognize these as the active ingredients in many over-the-counter heartburn remedies. Next, we have the mucosal defense enhancers. Think of them as the castle's engineers. They enhance the stomach's natural defenses by stimulating the production of mucus and bicarbonate, two substances that help protect the stomach lining from acid. They also promote blood flow to the stomach lining, which aids in repair and regeneration. Sucralfate and misoprostol are two examples of mucosal defense enhancers. Sucralfate forms a protective barrier over the stomach lining, while misoprostol stimulates mucus and bicarbonate production. And finally, we have the cytoprotectants. These are the elite guards of the stomach lining. Cytoprotectants work by strengthening the cells of the stomach lining, making them more resistant to the damaging effects of stomach acid. They also stimulate the production of substances that help repair any damage that has already occurred. An example of a cytoprotectant is ribamapide, which works by enhancing the production of growth factors that aid in cell repair and regeneration. But just like any battle strategy, the effectiveness of these drugs can vary from person to person, and they may not be suitable for everyone. For example, antacids can cause side effects such as constipation or diarrhea, and they may interfere with the absorption of other medications. Mucosal defense enhancers and cytoprotectants, on the other hand, are generally well tolerated, but they may not be as effective in relieving symptoms as quickly as antacids. So, while these drugs can provide relief and promote healing by protecting the stomach lining, it's important to remember that they are just one part of a comprehensive treatment plan for peptic ulcers. Lifestyle changes, such as avoiding spicy foods and reducing stress, as well as other medications like proton pump inhibitors and H2-Receptor Antagonists, also play crucial roles in managing this condition. And that's a wrap on our discussion about mucosal defense enhancers, antacids, and cytoprotectants. These drugs can provide relief and promote healing by protecting the stomach lining. In the world of peptic ulcer treatment, there are many effective tools at our disposal. We've delved into the pharmacology of proton pump inhibitors, or PPIs, the frontline warriors in ulcer treatment. These agents reduce gastric acid secretion by blocking the final step in its production, providing relief and promoting healing for those tormented by peptic ulcers. Next, we traveled through the realm of H2-receptor antagonists. These drugs work upstream in the acid secretion process, blocking histamine from stimulating the gastric parietal cells, resulting in decreased production of stomach acid. Their role is crucial in both the treatment and prevention of ulcers. We also explored mucosal defense enhancers, the bodyguards of the stomach lining. These agents enhance the stomach's natural protective mechanisms, fortifying it against the erosive effects of acid. They create a more hospitable environment for healing, helping to mend the damage caused by peptic ulcers. Our journey then brought us to the humble Antacids, the immediate relief providers. Their job is to neutralize the stomach acid, providing symptomatic relief from the burning pain of ulcers. Simple, yet effective. Lastly, we discussed the cytoprotectants, the unsung heroes in ulcer treatment. These agents form a protective barrier over the ulcer site, shielding it from further damage by acid and pepsin, and allowing for the healing process to occur. Understanding these drugs, their mechanisms of action, and their place in the treatment of peptic ulcers is essential for both patients and medical professionals. Knowledge empowers us to make informed decisions about our health and to drive the best possible outcomes in patient care. And that wraps up our deep dive into the pharmacotherapy of peptic ulcers. Each class of drugs plays a vital role, working in concert to alleviate symptoms, promote healing, and prevent recurrence. Subscribe for more because you won't find me later. Stay curious, stay informed, and most importantly, stay healthy.